The Walgreen Company is the largest drug retailing chain in the United States. As of January 31, 2014, the company operated 8,678 stores in all 50 states, the District of Columbia, Puerto Rico, the U.S. Virgin Islands and Guam. It was founded in Chicago, Illinois, in 1901. The Walgreens headquarters office is in the Chicago suburb of Deerfield, Illinois. Overview: Walgreens provides access to consumer goods and services, plus pharmacy, photo studio, health and wellness services in the United States through its retail drugstores, Walgreens Health Services Division, and Walgreens Health and Wellness Division. Walgreens had 8,206 drugstores as of January 31, 2014. Walgreens runs several online stores, such as www.beauty.com, drugstore.com and www.visiondirect.com. History, company history. Walgreens began in 1901, with a drugstore on the corner of Boyne Avenue and Contage Grove in Chicago, owned by Galesburg native Charles R. Walgreen, Sr. By 1913, Walgreens had grown to 4 stores on Chicago's South Side. It opened its 5th in 1915, and 4 more in 1916. By 1919, there were 20 stores in the chain. As a result of alcohol prohibition, the 1920s was a successful time for Walgreens. At the time, alcohol was illegal. However, prescription whiskey was available and sold by Walgreens. In 1922, the company introduced a malted milkshake, which led to it establishing ice cream manufacturing plants. The next year, Walgreen began opening stores away from residential areas. In the mid-1920s, there were 44 stores with annual sales of $1,200,000. Walgreens had expanded into Minnesota, Missouri, and Wisconsin. By 1930, it had 397 stores with annual sales of $4 million. This expansion partly was attributed to selling alcohol, mainly whiskey, which Walgreen often stocked under the counter, as accounted in Daniel Ockrent's Last Call, The Rise and Fall of Prohibition. The stock market crash in October 1929 and the subsequent Great Depression did not greatly affect the company. In 1934, Walgreens was operating in 30 states with 601 stores. After Charles Walgreen, Sr., died in 1939, his son Charles R. Walgreen took over the chain until his retirement. The Charles R. Walgreen years were relatively prosperous, but lacked the massive expansion seen in the early part of the century. Charles Corker Walgreen III took over after Walgreen Jr.'s retirement in the early 1950s, and modernized the company by switching to barcode scanning. The Walgreen family was not involved in senior management of the company for a short time following Walgreen III's retirement. In 1986, it acquired the Media Mart chain from Stop and Shop. In 1995, Kevin P. Walgreen was made a vice president and promoted to senior vice president, store operations in 2006. On July 12, 2006, David Benoit stepped down as CEO of Walgreens, replaced by company president Jeff Rain. Holding degrees in accounting and pharmacy from the University of Arizona, Rain was a pharmacist, store manager, district manager, and treasurer prior to being named chief executive officer and chairman of the board. Greg Wasson, former president of Walgreens Health Services, was named president and chief operations officer. On October 10, 2008, Rain abruptly quit as CEO, replaced by Alan G. McNally as chairman and acting CEO. On January 26, 2009, Gregory Wasson was named CEO, effective February 1, 2009. In 2014, Walgreens acquired the British drugstore chain Boots, a move which the New York Times associated with inversion, an effort in which large United States companies seek to ship their accounting to countries where tax rates are more favorable than those in the United States. 21st Century Expansion, 2006, Walgreens acquired the Happy Harry's chain in Delaware, Pennsylvania, Maryland and New Jersey. October 2007, Walgreens opened its 6,000th store in New Orleans, Louisiana. January 2008, Walgreens purchased 20 stores in Puerto Rico from Famezas El Amol. July 2009, Walgreens operates in all 50 states and the District of Columbia. February 17, 2010, Walgreens announced plans to acquire New York City area chain Duane Reade for $1.075 billion, including debt. Walgreens continues to operate in the New York City metropolitan area as Duane Reade. Its stores near existing Walgreens were closed. March 24, 2011, Walgreens acquired Drugstore.com for $409 million. Drugstore.com in turn owned Beauty.com. In 2013, Beauty.com was named by Internet Retailer magazine in its top 100 online retail sites list. April 30, 2011, Walgreens operated 8,169 stores. It had expanded into Guam and Puerto Rico. August 18, 2011, Walgreens introduced its Nice store brand of food and household products. Fully rolled out in 2012, the Nice brand replaced a variety of existing Walgreens store brands such as Deerfield Farms, Cafe W and others. June 19, 2012, Walgreens paid $6.7 billion for a 45% interest in Alliance Boots. July 5, 2012. Walgreens entered into an agreement to acquire Mid-South drugstore chain operating under the USA Drug, Super D Drug, Maze Drug, MedX, and Drug Warehouse banners. The deal was expected to be finalized by September 1, 2012. September 10, 2013, Walgreens announced it acquired Kerr Drug. August 6, 2014, Walgreens exercised its option to purchase the remaining 55% of Alliance Boots. The combined company to be known as Walgreens Boots Alliance with headquarters in Chicago. Contributions to popular culture. Walgreens claims credit for the popularization of the malted milkshake, invented by Vore Pop Coulson in 1922, although milkshakes and malted milk had been around for some time before. This development coincided with the invention of the electric blender in the same year. Corporate operations. Walgreens has its corporate headquarters in Deerfield, Illinois. As of 2009, Walgreens employed 5,200 people at its headquarters. In 1987, Walgreens employed about 1,100 people at its headquarters, which was at the time in an unincorporated area on the west side of Deerfield. As of 2000, headquarters was still in an unincorporated area in West Deerfield Township. In the summer of 2014, a corporate relocation to Switzerland was considered as part of a merger with Alliance Boots, a European drugstore chain. This drew controversy as many consumers felt that it was an attempt at tax inversion. On August 5, 2014, Walgreens announced that they would not be relocating their headquarters. Store model. Walgreens stores were originally connected to local groceries. In Chicago, their flagship market, they teamed up with either Eagle Food Centers or Dominic's Finer Foods, usually with a walk-through to the adjoining store and often sharing personnel. This concept was instated to compete with a popular dual-store format used by chief competitor duo Osco Albertsons Savon. They eventually ended the relationship with Eagle and focused primarily on a connection to the Dominic stores. Pharmex Rexall filled the vacated Walgreens locations joined to Eagle stores. In its 2009 business model, Walgreens are freestanding corner stores, with the entrance on the street with the most traffic flow, figuratively making it a corner drugstore similar to how many independent pharmacies evolved. Some stores have a drive-through pharmacy, while 3,000 refill inkjet printer cartridges. The store management team usually includes a store manager, an executive assistant manager, and at least one assistant manager. In 2009, Walgreens introduced the store team lead, or non-management keyholder, position in many of its stores. In 2012, Walgreens announced that they would be phasing out the MGT, EXA, and STL positions for the assistant store manager trainee, assistant store manager, and shift leader positions, respectively. The new management structure will implement a new structure and pay scale that will more closely resemble their competitors to reflect the industry standard. Disability Inclusion Initiative. In 2002, Walgreens Senior Vice President of Supply Chain and Logistics Randy Lewis began a program aimed at providing opportunity to the disabled to work side by side with typical workers. The result was the development and opening of 2 distribution centers whose staff is approximately 40% disabled. The model was so successful that other companies such as Clark's Companies N.A., GlaxoSmithKline, Best Buy, and Costco have either examined it or placed it under consideration. Related ventures. Walgreens used to own Sanborns, one of the largest pharmacy and department store chains in Mexico. Walgreens purchased Sanborns from Frank Sanborn in 1946 and sold it to Grupo Carso in 1982. In the 1980s, Walgreens owned and operated a chain of casual family restaurants, pancake houses called Wags, an attempt to compete with Woolworth's lunch counters. The Wags restaurants were very similar in concept to Denny's, IHOP and Golden Bear. At the high point, it had over 100 locations. Walgreens sold most of these to Marriott Corporation in 1988 and by 1991 the chain was out of business. Consumer record, prescriptions. As of June 2008, Walgreens agreed to stop altering prescriptions without physician approval as part of a multi-state agreement to settle allegations of improper billing, reported the Knoxville News-Sentinel. Walgreens was accused of switching the dosage forms on 3 medications commonly prescribed for Medicaid patients without doctor approvals in order to boost profits. This resulted in Medicaid programs nationwide paying much more for the medications than they normally would have, according to a press release by the Tennessee Attorney General's office. Walgreen Company agreed to comply with state and federal laws on the matter, plus pay $35 million to the federal government, 42 states and the Commonwealth of Puerto Rico. The compliance agreement will be in effect for 5 years. Walgreens did not admit liability, as part of the settlement, reported the Chicago Sun-Times. The Walgreens website invited users to write reviews of some OTC products such as vitamins and nutritionals, but did not invite users to write reviews of the corresponding Walgreens branded products. A recent revision of the Walgreens website has added the ability to review any product it sells. Allegations of discrimination. In March 2008, Walgreens settled a lawsuit with the Equal Employment Opportunity Commission that alleged the company discriminated against African Americans for $24 million. The settlement was split between the 10,000 African American employees of the company. In the agreement, Walgreens avoided any admission of guilt. The decree, one of the largest monetary settlements in a race case by the EEOC, provides for the payment of over $24 million to a class of thousands of African American workers and orders comprehensive injunctive relief designed to improve the company's promotion and store assignment practices. In September 2011, Walgreens settled a lawsuit with the Equal Employment Opportunity Commission which claimed that a store improperly terminated a worker with diabetes for eating a package of the store's food while working to stop a hypoglycemia attack. Medicaid. Also in 2008, Walgreens agreed to pay $35 million to the U.S., 42 states and Puerto Rico for overcharging state Medicaid programs by filling prescriptions with more expensive dosage forms of ranitidine, a generic form of Zantac, and fluoxetine, which is a generic form of Prozac. In 2009, Walgreens threatened to leave the Medicaid program, the state and federal partnership to provide health insurance coverage to the poor, in Delaware, over reimbursement rates. Walgreens was the largest pharmacy chain in the state and the only chain to make such a threat. The state of Delaware and Walgreens reached an agreement on payment rates and the crisis was averted. In 2010, Walgreens stopped accepting Medicaid in Washington state, leaving its 1 million Medicaid recipients unable to get their prescriptions filled at these 121 stores. Personal data. In March 2011, Walgreens was sued in California by customers for allegedly selling customers' medical information. According to the suit, brought by Todd Murphy on behalf of his 2 daughters and the rest of the class, Walgreens sells the prescription information to data mining companies who resell it to pharmaceutical companies for marketing purposes. The practice allows drug makers to target physicians considered high-volume prescribers and those most willing to prescribe new medications, it said. In 2011, Walgreens announced it would end its relationship with Express Scripts, a prescription benefits manager. A coalition of minority groups, led by Reverend Al Sharpton's National Action Network, sent letters urging CEO Gregory Wasson to reconsider. Groups sending letters were National Hispanic Christian Leadership Conference, the Congress of Racial Equality, Hispanic Leadership Fund and others. On July 19, 2012, Walgreens and Express Scripts announced a multi-year pharmacy network agreement that includes rates and terms under which Walgreens would participate in the broadest Express Scripts retail pharmacy network available to new and existing clients as of September 15, 2012. Use of proprietary drugs. Walgreens was named in a lawsuit by the Union Food and Commercial Workers Unions and Employers Midwest Health Benefits Fund in the Northern District Court of Illinois in January 2012. The suit alleges Walgreens and Par Pharmaceuticals violated the Racketeer-Influenced and Corrupt Organizations Act, at least two widespread schemes to overcharge for generic drugs. The lawsuit alleges drugstore chain Walgreens and generic pharmaceutical maker Par established a partnership in which Par manufactured and/or marketed generic versions of antacid Zantac and antidepressant Prozac in dosage forms that weren't subject to private and governmental reimbursement limitations. It further said Walgreens purchased those dosage forms from Par at a cost substantially higher than the widely prescribed dosage forms, and then systematically and unlawfully filled its customers' prescriptions with Par's more expensive products, rather than the inexpensive dosage forms that were prescribed by physicians. Distribution of Oxycontin. In September 2012, the U.S. Drug Enforcement Administration accused Walgreens of endangering public safety and barred the company from shipping Oxycontin and other controlled drugs from its Jupiter, Florida distribution center. The DEA said that Walgreens failed to maintain proper controls to ensure it didn't dispense drugs to addicts and drug dealers. The DEA also said that 6 of Walgreens' Florida pharmacies ordered in excess of 1 million Oxycontin pills a year. In contrast, in 2011, the average pharmacy in the U.S. ordered 73,000 Oxycontin tablets a year according to the DEA. One Walgreens pharmacy located in Fort Myers, Florida, ordered 95,800 pills in 2009, but by 2011 this number had jumped to 2.2 million pills in 1 year. Another example was Walgreens pharmacy located in Hudson, Florida, a town of 34,000 people near Clearwater, that purchased 2.2 million pills in 2011, the DEA said. Immediate suspension orders are an action taken when the DEA believes a registrant, such as a pharmacy or a doctor, is an imminent danger to the public safety. All DEA licensees have an obligation to ensure that medications are getting into the hands of legitimate patients, said Mark Troville, DEA special agent in charge of the Miami Field Division. When they choose to look the other way, patients suffer and drug dealers prosper. The Jupiter, Florida Distribution Center, which opened in 2001, is one of 12 such distribution centers owned by Walgreens. Since 2009, Walgreens' Jupiter facility has been the single largest distributor of Oxycontin in the state of Florida, the DEA said. Over the past 3 years, its market share has increased, and 52 Walgreens are among the top 100 Oxycontin purchasers in the state, the DEA said. Sale of tobacco. In common with other U.S. pharmacies, Walgreens stocks tobacco products for sale to the public. Some campaigners in the USA advocate the removal of tobacco from pharmacies due to the health risks associated with smoking and the apparent contradiction of selling cigarettes alongside smoking cessation products and asthma medication. Walgreens and other pharmacies who continue to sell tobacco products have been subject to criticism, and attempts have been made to introduce regional bans on the practice, notably by the city and county of San Francisco. Walgreens defends its tobacco sales policy by reasoning that through selling tobacco in its outlets, it is more readily able to offer to customers advice and products for quitting smoking. See also: corporate inversion, CVS Caremark, Rite Aid, Ships Ice Cream, Alliance Boots. References. Bibliography: Bacon, John U. America's Corner Store, Walgreens Prescription for Success. Hoboken, John Wiley & Sons. ISBN A978-0-471-42617-2. External links: Walgreens official site, Walgreens Quick Shop site, Walgreens Health Initiatives, Health Corner, Take Care Health Systems, Company information from Yahoo! Finance.